Hi, my name is Dr. Peter Warinner. I'm author of The Art of American Healthcare. This book is essentially an expose regarding the inner workings of the American healthcare system. In this book, I uncover many of the serious flaws, mostly hidden from the general public. Most importantly, though, I propose numerous innovative solutions to solve these problems that will only get worse if we don't act now. Historically, the doctor-patient relationship was very private, and for the sole purpose of the patient, under very vulnerable circumstances, seeking answers from an expert medical doctor. The doctor would then focus on that patient in that moment and do what is best for that patient. Now you have many entities and individuals inserting themselves in between the patient and the doctor to interfere with the diagnostic process, interfere with the treatment process, and essentially ruin the healing process for the patient. So you have the patient, you have the doctor. Historically, they used to work very closely together in a very intimate setting. Now we have federal and state governments inserted in between them with their crippling regulations. We have insurance companies with multiple policy requirements, increased deductibles, decreased coverage, inserting themselves in between the patient and the doctor. We have hospitals and hospital administrators with their outrageous guidelines and restrictions and all kinds of regulations they place upon the doctors in their affiliated networks, inserting themselves between the patient and the doctor. We have some sort of societal dedication to increasing profitability of pharmaceutical companies and biomedical technology companies, all at the expense of the doctor and the patient, diminishing healthcare funding that should be going for the doctor and the patient. The electronic health record systems that have arisen in the last several years literally force the doctors to turn their backs on their patients as they generate electronic medical records. A litigation system that forces unhealthy distortions upon every medical practice in the way it keeps its records, the way it manages patients, in the way it makes decisions, diagnostic decisions, treatment decisions, none of it in the best interest of the patient, and so on. So now you have the doctor and the patient as far apart as can be. And the doctor has to go through all of these obstacles to get a chance to try to help the patient, and do it in just a few minutes. This represents a complete failure of the current healthcare system. As the doctor has lost his focus through no fault of his own, through the intrusions by these other entities and forces and individuals, the patient is the one who suffers, literally and figuratively. The quality of patient care is now completely sacrificed and lost in the current healthcare system. I envision a future healthcare system that brings the patient and the doctor back together again and treats the doctor-patient relationship as sacred. In this scenario, we will not exclude all of the other entities and individuals involved in the healthcare system, but we will remove them from coming in between the patient and the doctor. They will no longer be obstacles and barriers. Instead, these entities and individuals will figuratively surround the patient and the doctor, and will participate only to the extent that the patient or the doctor reaches out for their assistance. All other entities and individuals in this future healthcare system will be secondary to and subservient to the patient and the medical doctor.